So, anatomy. So, it's not very difficult, it's pretty easy. So, the first point is it's also called gaster. Also called gaster. So, it's probably a Greek word, and that is why everything related to stomach is called gastro. No, gastric. Gastro slash gastric. So the stomach is a muscular bag. What is stomach? Stomach is a muscular bag, and it is the most distensible part of the whole GI system. So it's the most distensible part of the whole GI system, and it is fixed to the esophagus above. It's fixed at 2 points actually. It's fixed at esophagus above and the pylorus below. So it's a distensible structure which is fixed at 2 points, at esophagus above and pylorus below. So we have one point is this one with the gastroesophageal junction, GE junction we call it, and the other one is this pyloric ring or pylorus. So it is fixed at these points, and the rest points are freely mobile, and the function is to start the digestion of food. So what is the function? It helps in digestion. That is the most important function of stomach. So it starts the digestive activity of the GI system. It's actually started in the mouth itself, which max out in small intestine. Also, it acts as a reservoir for food, as a reservoir. So it's a reservoir for food. Anyways, that is physiology. So next we see is the location. Where does it lie? So location is upper and left part of the abdomen. Upper and left part of the abdomen. So if you were to see the regions, it occupies 3 regions basically. So epigastric region, umbilical region, the upper part that is, and the left hypochondriac region. And most of it is covered by the left side ribs and the costal margins. So this diagram will help us understand more about the location of the stomach. So it is basically in the upper and left area, and the regions occupied are umbilicus and left hypochondrium region and supraumbilical region, and it is mostly under the cover of ribs and the subcostal margins. Also, if we talk about the shape, it is a J-shaped structure. You can see in the figure, it's a J-shaped structure. Then talking about capacity, so capacity actually changes with age, and mota we can know that capacity in adults. So the capacity in adults is around 1.5 liters to 2 liters. So this is the capacity in adults. So next is orifices. So there are two orifices. Number one is the cardiac orifice. Number two is the pyloric orifice. So let's start here. So at the G junction we'll have the cardiac orifice is here and pyloric orifice is here. So in cardiac orifice we have a physiological sphincter not visible anatomically. So this cardiac orifice is at the level of vertebra T11 and this pyloric orifice is at the level of lower border of vertebra L1. Lower border. So in the diagram the cardiac orifice is at the level of vertebra T11 and this pyloric orifice is at the level of vertebra L1, lower border. So next we have two curvatures. After orifices, let us discuss curvatures. So we have number one, greater curvature, and we have the lesser curvature. Greater curvature and lesser curvature. So in the diagram let us mark it. So this is the lesser curvature and here is the greater curvature. So this is the right side of the body and this is the left side of the body. Greater curvature lies on the left side, lesser curvature lies on the right side. So greater curvature is 5 times longer than the lesser curvature approximately, and lesser curvature also has the incisura angularis in its most dependent part. And the greater curvature has the cardiac notch. Which is the angle between the greater curvature of the stomach and the esophagus. Talking about surfaces after curvature, so we have two surfaces, anterior surface and a posterior surface. So talking about parts of the stomach. So we have 4 parts. It's basically different in different books. So we have the fundus, then we have the body, we have the pyloric antrum, then we have the pyloric canal or the pyloric canal. So in the diagram let us see. So if we draw a line here from the cardiac notch, a horizontal line, we can see that the above part will be the fundus and it is frequently seen in the x-rays, if it is x-ray chest or x-ray abdomen, where we see a gas bubble, and this gas is present in the fundus. So this part here, the main part would be the body of the stomach, and we have the pyloric antrum, next we have the pyloric canal. So this pyloric canal is 2.5 centimeter long. How much it is? 2.5 centimeter long, and it connects the stomach to the duodenum. The body is the main part of the stomach. It helps in digestion. It has all the major glands. So pyloric antrum is separated from the pyloric canal by an inconstant sulcus called the sulcus intermedius, and these two are separated by an inconstant sulcus called the inconstant sulcus intermedius. Separates them. So next up is peritoneal relations. So the greater curvature has the greater omentum attached to it, and the lesser curvature has the lesser omentum attached to it. Also, if we see in the diagram, in its upper part, we can see that there is gastrosplenic ligament and gastrophrenic ligaments on the greater curvature, gastrosplenic ligament and gastrophrenic ligament. And superiorly, in the posterior part, there is also bare area of stomach, where there is direct attachment to diaphragm and there is no other attachment. So to the greater curvature, we have extras called the gastrosplenic ligament and gastrophrenic ligament. As the name suggests, gastrosplenic ligament connects the spleen and the stomach. Gastrophrenic ligament connects the stomach and the diaphragm. So lesser curvature, lesser omentum, greater curvature, greater omentum, gastrosplenic and gastrophrenic ligaments. So we also have an entity here called the Traube space. So it's a named entity, so it's important. Traube space. What is Traube space? It's the space bounded by lower margin of left lung, left costal margin, and inferior border of liver, left lobe of liver, anterior border of spleen. So 4 markings. lower margin of the left lung, left costal margin, inferior border of the left lobe of liver, anterior border of spleen. Basically, we have to know that this Traube space lies above the left upper margin of the stomach, and its clinical importance is in assessing for splenomegaly. So basically there is a resonant note over it, and in splenomegaly there is a dull note over this area, which can be due to other reasons such as a mass as well. So it's not very specific or sensitive, but anyhow it's of some clinical importance. So in splenomegaly there will be a dull note over this Traube space, and in normal circumstances, if it is within normal limit, there will be a resonant note on percussion. So it can be used to assess splenomegaly, Traube space. So next we see the blood supply of the stomach. Blood supply. So let us draw the celiac trunk. So this celiac trunk arises from the abdominal aorta and is the most important part of the blood supply to stomach, because everything mostly is from the celiac trunk. So this is the left gastric artery, and it directly supplies the lesser curvature of the stomach. And another important artery that arises from the celiac trunk is the common hepatic artery. So this is the common hepatic artery, and it gives off a branch called the gastroduodenal artery. So this is the gastroduodenal artery, and then it becomes the proper hepatic artery, and from proper hepatic artery rises the right gastric artery. So this is the right gastric artery, and it supplies the stomach directly. And what is the third artery that arises from the celiac trunk? It is the splenic artery. Which passes parallel to the pancreas behind the stomach, and then supplies the spleen, which lies somewhere over here. So it splits into branches to supply the spleen. This is the splenic artery. So this splenic artery gives off a branch called the left gastroepiploic artery. So this is the left gastroepiploic artery. Arising from the splenic artery. So the left gastroepiploic artery. And then we have the right gastroepiploic artery which arises from the gastroduodenal artery. So right gastroepiploic artery supplying the stomach directly, and the left gastroepiploic artery supplying the stomach directly. Then we have the short splenic arteries. So let us label them one by one. So first of all, this is the celiac trunk. It arises from the abdominal aorta. And from celiac trunk we have three branches, particularly the left gastric artery supplying directly into the stomach, left gastric artery. Then we have the common hepatic artery, common hepatic artery, and the third branch arising is the splenic artery, which is going all the way parallel to the pancreas behind the stomach. So the common hepatic artery gives off a branch called the gastroduodenal artery. So after giving off the gastroduodenal artery, it becomes the proper hepatic artery. So then the story goes that the proper hepatic artery gives off a branch called the right gastric artery. Then we have a branch of the splenic artery, the left gastroepiploic artery, which is a branch of splenic artery. And the last artery to be marked here is last major artery, is the right gastroepiploic artery, and right gastroepiploic artery is a branch of the gastroduodenal artery, which is a branch of the common hepatic artery, which is a branch of the celiac trunk. So last but not the least are the short gastric arteries. So this is the complete arterial blood supply of the stomach. So venous circulation. So it follows the arterial circulation. So we have the left gastric vein, right gastric vein, left gastroepiploic vein, right gastroepiploic vein, and short gastric veins. They follow the arteries. We have to know where they drain. So left and right gastric veins they drain into the portal vein. Number 1. Number 2 is the right gastroepiploic vein. Right gastroepiploic vein drains into the superior mesenteric vein. Then third is the left gastroepiploic vein, which drains into the splenic vein. Also, the short gastric veins drain into the splenic vein. So this completes the blood supply of the stomach. So next we talk about the lymphatics of the stomach. Lymphatics. Of stomach. So lymphatics. So for the purpose of lymphatics, we divide the stomach into parts. So this is the right 2/3, left 1/3, left 1/3, and another lower 1/3. So let us draw the nodes. We have left gastric nodes, pancreaticosplenic nodes, gastroepiploic nodes, subpyloric nodes, hepatic nodes, and lastly celiac nodes. So these are the most important nodes. Celiac nodes, because ultimately all the lymph from the stomach flows into the celiac nodes. Let us draw the direction of the flow. Gastric nodes, pancreaticosplenic nodes, right gastroepiploic nodes, subpyloric nodes, subpyloric nodes, celiac nodes, now let us label them. So this is the pancreaticosplenic nodes, which are draining the upper left 1/3. Then we have the right gastroepiploic nodes, then we have the subpyloric nodes, They are present between the second and third part of duodenum. And we have the left gastric nodes. This is the hepatic nodes. And the most important, where all the lymph flow goes, is the celiac nodes. And where from celiac nodes? And from celiac nodes, this lymph flows to the cisterna chyli. So this completes the lymphatics of the stomach. Now let us do the nerve supply quickly. So the nerve of stomach. So it is number one, sympathetic. Nerve supply. So it is derived from T6 to T10 of spinal cord, and this supply is via the greater splanchnic nerve, also the celiac plexus, and it is responsible for the pain sensation, number one, and it is motor to the pyloric musculature, motor to pyloric musculature, but inhibitory to the rest, inhibitory to the rest of the stomach musculature. So basically sympathetic nerve supply gives pain sensation and it reduces the GI movement because it will inhibit the stomach musculature and contract the pyloric musculature, so food will stay there. Next is parasympathetic supply. So it is derived from the vagus. So the mnemonic is LARP. What is LARP? LARP is left anterior vagus nerve and right posterior vagus nerve. Left anterior vagus and right posterior vagus nerve. So what happens is when the vagus nerve is on the esophagus, the left vagus nerve is anterior and right vagus nerve is posterior. So in parasympathetic fibers we have two nerves, anterior gastric nerve which has the fibers of the left vagus, and the posterior gastric nerve which has the fibers of the right vagus. Right vagus is posterior gastric nerve. So these parasympathetic nerves are motor and secretomotor to the stomach. And inhibitory to the pyloric musculature. So it causes increased motor activity of the stomach and release of gastric juices. Parasympathetic nerves cause the release of gastric juices into the stomach. So now lastly we will see the layers of the stomach. Layers of stomach wall. So we have 4 layers. Number 1 is from the outside we will start. So we have serosa, which is a layer of visceral peritoneum. Next we have muscularis propria, or it is also called muscularis externa. So it has 3 layers of smooth muscles. 3 layers of smooth muscles, and the inner is circular. The third layer is submucosa. So this is the collagen rich layer, submucosa, and it is the strongest layer of the gastric wall. And on the innermost surface we have mucosa. Mucosa is also subdivided into 3 parts. We have muscularis mucosae, lamina propria, and the surface epithelium. And within these layers we have 2 plexuses of nerves. So in muscularis propria we have Auerbach's myenteric plexus. Myenteric is muscular. So we have Auerbach's myenteric plexus in muscularis propria, and Meissner's plexus in the submucosa, which is the strongest layer. So these are the 4 layers: serosa, muscularis propria or externa, which has 3 layers of smooth muscles, and inner is circular. Then we have the submucosa, which is the strongest layer, containing the Meissner's plexus, and mucosa, which is consisting of muscularis mucosa, lamina propria, and surface epithelium. So we have completed the anatomy of the stomach, and we have the notes. And next up we will cover the surgical anatomy.